respected leaders in the healthcare industry, Spectrum Health and Select Specialty. We are really talking about how this brings together care that can be provided to medically complex patients, critically ill patients, and to provide it here in a wonderful setting. Opening August 1st, this hospital within a hospital is designed to meet those growing needs of those patients. Our speakers today, my name is Tina Fries-Decker, Executive Vice President, COO for Spectrum Health, and I have a number of speakers here with us today to share with you some of the details about our joint venture and what this means. But what I wanted to talk about was a key philosophy at Spectrum Health about what we're focusing on. And I want to stress that this isn't just a joint venture. This is a new way of thinking for Spectrum Health. It's thinking about partnerships and how we can do them even better and to really expand on the benefits of both organizations to create something more beneficial for the people that we serve. I personally believe that one of the greatest important aspects of healthcare is connecting together and sharing in those goals to do something better for our community. And so we recognize the significant talent in Spectrum Health and at Select Specialty, and we know that by combining this together in this hospital within a hospital can drive that expertise and care so much more for our patients. We are very excited about this new relationship and the positive impact that it has for our community. We also know that this is innovative. So Spectrum Health prides itself on being an innovative organization, especially with clinical therapies. Now we're expanding this to include other innovative thinking to our care delivery system to help us better meet the needs of our healthcare consumers. A few years ago, we may not have considered doing a hospital within a hospital, but today we are. We're continuing to push the limit to see what is best for our community. And so I'm very proud that we've looked at this strategy and we've partnered with Select Specialty to really provide this care here locally. So now I'd like to introduce Gwen Sandifer, our president for Spectrum Health Hospital Group, to share with us more about what this location provides.
Thank you, Tina, and thank you all. We're just truly so excited about this, and in partnership with Select, which has a national recognition, in partnership with this local community and all the local healthcare providers who have worked separately up until now and now can come together and do so much more for our patients. So to put in context what Tina just said, today we do have LTACH patients, long-term acute care hospital patients, residing currently within Spectrum Health's Fuller campus. And for the Spectrum Health patient, that has meant a transfer of that patient anytime there were high-end diagnostics required or an acute admission required. And so the change itself to ensure that we have those long-term acute care hospital services available within Blodgett so that that patient does not have to be transferred physically by ambulance and instead could be transferred within a facility, just tremendous value, better quality, so much less disruptive, and we're so proud of that. To be able to do that with Spectrum, with Select Health, who are also then going to have patients here so that all long-term acute care services are provided in one facility for this community, really just can't be underscored or under-highlighted about the significance of this change. We also want to talk about the teams. These teams have come together. I heard some just talking about it's like an arranged marriage today. We're creating a new family, and that can be something to be fearful of in some cases, but honestly, the teams are excited. They want to learn about how each other are working and what the future can be. So I sense so much excitement. The thanks that need to go around are frankly unlimited. The timeline of this project has been significantly short, at least from Spectrum Health's perspective. For those of you at Select, you might need to know we're not known at times for moving quickly. And there were bets all around last year about could we indeed accomplish this in the timeline. And the teams that have come together, led by Chad Tuttle, Julie Wallowitz at Blodgett Hospital, related to the facility and the intersections that need to be created here. Julie Rosier, who's a project manager who has brought together all these diverse teams. Brian Hinesley, who's really acted as the Blodgett project manager. Dr. Steve Nimerson, who's taken on the great challenge of medical staff development, has truly been impressive. So thanks to all of you. I also heard that Gordon Netterfeld and his whole team were here yesterday doing last-minute work that should take none of you by surprise. So many thanks to all of you behind the scenes and in front leading the way. And for those of you at Select, please know that you really are coming together with an excellent team of people who are well-intentioned about our patients and our service to them. Lastly, I'd like to say that just our patients truly are the focus. So it's not about a facility, it's not about a Select or a Spectrum Health per se or a joint venture. It truly is about improving the care for our patients. And these patients are long-term acute care. Sometimes that's misperceived. It's not long-term care. These are long-term ICU type of patients. And so please all keep that in mind as we continue to evolve the work that we do for this patient base. And I would now like to invite Mike Cannon, Regional Vice President, Select Medical, to say a few words on their behalf.
So first off, just speaking off the top of my head, the blended marriage, it's been interesting the last 90 days, but what I would say with that is I think it's meant to be, though. I think we've found that this truly is a good partnership even in these last 90 days, and we're excited to be a part of this for the long term. The things that we're going to do together is going to be pretty exciting. I know that from the Select Medical side, our local team here, I'm looking at Sam right there, our team is so excited to be a part of the Spectrum team and to see what we can really accomplish from the pieces of this community where we can. So thank you for that. As a brief introduction, Select Medical is a national provider of specialized healthcare based in central Pennsylvania. We operate hospitals and outpatient sites in 46 states, including Washington, D.C. We have primary expertise in long-term acute care, medical rehabilitation, outpatient physical rehabilitation, and occupational medicine. We were founded 20 years ago by the father and son duo of Rocco and Robert Ortenzio. Although we've grown dramatically, we've retained a close-knit family feel and operate much like a small business. And hopefully, Chad, with you and I working together, you've been able to see that we are a very tight-knit group, and even though we have over 40,000 employees, we don't operate like that. At Select Medical, we strive to deliver exceptional experiences for our patients as well as our dedicated and talented employees. We are open and receptive to learning and improving and always welcome opportunities to collaborate. This allows the Select Medical team to identify and implement new best practices, ones that drive care innovation and achieve optimal outcomes. Speaking of patient outcomes, Select Medical offers a wide range of care from inpatient to outpatient. In our 102 long-term acute care, or LTACH, hospitals, we treat high acuity and medically complex individuals. Many are chronically critically ill or post-ICU patients who require extended hospital stays. Others come to us dependent on mechanical ventilation with complex wounds and or following a devastating injury or illness. We work tirelessly and with great compassion to help them in the journey of healing and recovery. In our small and special environment, we give them the individualized care and attention needed to return to full and productive lives. We look forward to doing so with Spectrum Health at Blodgett Hospital at the new Select Specialty Hospital, Spectrum Health. At Select Medical, we have a model that drives our success, and that is to create meaningful partnerships with leading healthcare and hospital systems. We look for partners who share our 5 core values: to deliver superior quality, to treat others as they want to be treated, and to be results-oriented, team players, and resourceful in overcoming obstacles. We have found these admirable qualities at Spectrum Health and are delighted to be joining forces as partners. As the famous saying goes, alone we are strong, together we are stronger. Thank you, and I look forward to what we can accomplish together.
And so now we get to the good stuff, which is the ribbon cutting. So we do have at the ribbon cutting Tina Fries-Decker, Matt Cannon, we need Brian Williams, Chad Tuttle, and myself. I also just want to let you know that they have committed to August 1st, so we do plan to proceed ahead.
Thanks, Gwen. And I think Brian Williams was unable to join us due to flight constraints this morning, so there were some pretty significant storms out east.
All right. The scissors.
Sure. We even dressed alike.
I know.
Safety first, right?
Refreshments. We do have mingling opportunities, so feel free to come around. We have different visitor escorts as well who can answer any question you may have. Thank you all.